Bismillahirrahmanirrahim. Thank you very much, all of you, for coming in. Um I again will definitely try to cover up the topic, whatever is comfortable. But if you people have any questions, you can interrupt me. मैं फिर वही एक सवाल बार बार पूछता हूँ और मैं फिर दोबारा पूछूंगा. If you people are interested in covering up any specific topic, you just let me know. I'll try to do that. What I have seen over the period of months since the time I started presenting is that the good part is that if I do the interactive session, it is participated more appropriately, so people are able to talk, communicate, and interact. But most of the time, when I'm doing a presentation, that is not taken as it should be taken, or maybe my expectations are that probably that will be taken appropriately, but I don't think so. So, what I will be doing from today onwards, not today, but afterwards, that we will select a topic, we will try to present, and then we will discuss the topic and interact with each other so that the real life situations and your patient's interaction and your questions hopefully will be uh, again more interactive than anything else, right? So let me start this presentation. I don't know, somehow or the other, this presentation is an old one as well, but there are few poetry things into it. Every time when I'm presenting, I try to skip it because of the fact that I feel that that is relatively too much. But today I think I have time, so I will go through that as well. To start with, मेरी रात दिन में छुपी छुपी, मेरा दिन छुपा किसी रात में, मेरी जिंदगी एक राज है, कोई राज है मेरी बात में, मैं जहां कहीं भी उलझ गया, वहीं गिरते गिरते संभल गया, मुझे ठोकरों से पता चला मेरा हाथ है किसी के हाथ में. And I always feel that considering whatever we think is appropriate, this seems to be okay. Oh my God. Okay. Can I see it? No. Okay. Okay. Got it. So today I will be covering trauma and related terminologies. PTSD across recent history. In 1850s and 60s, some of the symptoms which were seen in people who were participating in war were quoted as Crimean War or neurasthenia. In 1860s and 1880s, there was a big railway accident in US where lots of people had spinal concussion and spinal injuries and head injuries as well. And there were some symptoms which were considered to be as related to it. And then some symptoms related to PTSD were described even at that time. Similar kind of the symptoms were quoted as soldier's heart, irritable heart, or Da Costa's syndrome in 1860 and World War I. In World War I, after that was over, a lot of people started complaining about some type of symptoms which are still considered as a symptom of PTSD now, and they were called neurocirculatory asthenia, or shell shock, or hysteria, or combat exhaustion. In DSM 3, for the first time in 1980, the PTSD was termed as a disorder. So, post traumatic stress disorder, first time was coined in 1980. So, even much after when I started practicing psychiatry. At that time, when I started teaching my residents and the other doctors in Pakistan about PTSD, मेरा बहुत सारे लोगों ने बहुत मजाक उड़ाया. और literal sense में people felt that I'm talking of some nonsense or non-cynical situations which probably don't exist in Pakistan. So people were never acknowledged that it's a disorder. And it's my real life story, so I'm telling you that this new term which was launched in DSM-3 in 1980s and 90s, and back in 97, 98, I did 2 presentations on that, and people never accepted it as a diagnosis. And 94, first time the acute stress disorder was termed as a diagnosis. So all of these things started off with the situation that there is some trauma related situation. So psychotrauma, psychological trauma, or PTSD were later on explained. Now the situation is that the person, how can we define mental trauma? I'm not talking about physical trauma. So what is a trauma? A person has been exposed to a traumatic event in which, now there are five, six things in it. The person has experienced, witnessed, or being confronted with an event that involves actual or threatened death or injury or a threat to the physical integrity of oneself or others. Now, there are 7, 8 things in this definition. One, it's not necessary that I was actually saw something, even if I have experienced something, or I felt that this is bound to happen, right? Even then, it is included in mental trauma situation. Second, actually or even threat. So if I felt that one of the people here, say Benazir, is threatening, I feel threatened with her behaviors, even then it comes in the terms of trauma. Physical integrity of oneself or others. So एक डर, एक खौफ कि ये शख्स मुझे नुकसान पहुंचा सकता है, ये भी मेंटल ट्रॉमा के जुमरे में आता है, to be very precise. The person's response involved intense fear, helplessness, or horror. So, all of these things are in definition of trauma. Examples of traumatic experiences. Interpersonal violence. घर में अगर बच्चे के ऊपर सिर्फ जोर जबरदस्ती की बात भी की जाए, इट्स इंटरपर्सनल वायलेंस. कैप्टिविटी, किसी को अगवा कर लिया जाए, then it is post traumatic experience. Sexual, of course, rape and incest, not only witnessing but even reading it in the newspaper can be again incorporated into trauma, mental trauma. Combat trauma and terrorism. This is unfortunate that when we see the news channels, international news channels, and the channels which are shown in Pakistan, there's a huge difference. So internationally, even when there is a war somewhere, or people are hit, or there is blood, it is not shown in media. In Pakistan, everything is open. So people post on WhatsApp group murders and killings, and they don't feel it's a problem. I, in various groups, kept on saying it time and again, please don't post these videos. These videos could be traumatic for most of the people who are watching it, even if not less, more than 50% of people. Even I myself feel I cannot see a murder happening in the remote village of Lahore. If you want to raise voice, you definitely raise voice, but don't show these events because it could be traumatic to a lot number of people. Car accidents. If I'm driving in a car and I am bumped with someone from the back, no injuries, no damage, nothing. Even that bump at the back of my car with a loud bang can be a mental trauma for someone. Near drowning experience, workplace injuries, and serious disorders, serious burns. So they are all traumatic experiences. Talk about more grave traumatic experience: earthquake, tsunami, hurricane, typhoon, flooding, tornado. Now these are getting more intense over the period of time. And other events, unexpected death of a family member or a close friend. अभी मैं बात कर रहा था अपने साथ बैठे हुए कुछ लोगों के से, और मैं ये बात कर रहा था उनके बात के, या यहाँ लोग पागल हैं या वहाँ लोग पागल हैं, कहीं एक जगह पे तो गड़बड़ है. पागल का लफ्ज़ थोड़ा अनफॉर्चुनेटली इंटेंस है, But the reason I want to use it is that here people are still isolated, quarantined, separate, not mixing, no gatherings, no functions, no shadi bia, no halla gulla, nothing of that sort. There, I saw recently a marriage day before yesterday. People were dancing, hugging, caressing publicly. In 30 years of my psychiatric practice, I haven't seen so many deaths in Pakistani psychiatric fraternity as I have seen in just 1 year. At least 15 to 20 major big psychiatric names in psychiatry suffered from this disease and were hospitalized and ventilated. It's a trauma. It's a trauma for me and it's a big trauma for everyone who's having this encounter. But people don't realize it there. Here, for past 1 year, I am doing everything virtual. I don't know why the country is so. So, mental health perspective of trauma related to mind. Typical reactions, cognitive. Cognitive reactions are confusion, disorientation, worry, intrusion, determination, clarity of mind, heightened perception. So अगर मेरी गाड़ी पे किसी ने मार दी गाड़ी और बम की आवाज से मैं घबरा गया हूँ चौंक गया हूँ तो immediate reaction क्या होता है confused, disoriented, worry, and then I will try to see what I have to do, get out of the car, see the damage. So heightened perception. All of these things, technically, confusion, disorientation, worry, intrusion, determination, clarity of mind, and heightened perception. Then emotional, shock, sorrow, grief, sadness, fear. And with them, simultaneously, optimistic, challenged, involved, and pressured to act. Because there is a crisis situation, so I will be definitely into it and I will try to compromise whatever is available and there. Then interpersonal, withdrawal, anger, and with it, I will be having affiliation, closeness, altruistic response. लोगों को बचाऊं, भागूं, संभालूं, देखूं, इसको पकड़ लूं, उसको उठा लूं, इसको साइड पे कर दूं, whatever is the situation. These are common situations. So I know that all of you would be able to understand this. Then physiological. I will be after that, I will be fatigued, I may have headache, muscle tension, or my heart rate may go down. But at the same time, it will be alertness activation. Alertness activation. So that is there too. Responses to mass trauma, when there is an earthquake, when there is a tsunami, when there is a bomb blast, when there is some other kind of a situation, then specific psychological problems. We conducted a study which was published in Journal of College of Physician and Surgeon, and most of this data is similar to what we have seen. Specific psychological problems, 74%. So if you have a bump in a car, in a roadside accident, 74% of the people will have some psychological problems. Although these problems may go back to normal in few hours, few days, few months, depending on the severity. But it's there. PTSD in 64% of the people. Depression 37% and anxiety 19%. Non-specific distress 39% and health problems and concerns 25%. If you see these figures, PTSD appears to be very, very common with the situations happening around us. Even if I talk about, say, COVID, PTSD will be common. So if somebody, like I am witnessing 7 deaths of psychiatrists in Pakistan in past 1 year time, I am definitely frightened and I may develop PTSD, 64% chances of developing PTSD. Other anxiety disorders, some symptoms of PTSD overlap with phobic symptoms like distress at related trauma related events and avoidance of such events. So I won't go out, I won't drive, I won't participate, things like that. And other symptoms of PTSD overlap with generalized anxiety disorders, for example, hypervigilance, arousal. Now, in most of these situations, these symptoms won't be there unless or until you will try to see them. And in exam situation, I was assessing a candidate who had a clear patient of PTSD who was clearly mentioning कि ये वाकया हुआ था उसके बाद से ये मुझे हो रहा है, and the candidate was not able to say PTSD in his diagnosis and he failed. So you people must be able to acknowledge this diagnosis, what I'm saying. In exam situation especially. In clinical situation फिर बचत हो जाती है, exam situation में बचत नहीं होती. So coming back, as I told you in the beginning, that I will be saying few things related to poetry, so I will do that today. मुझे जुस्तजुए इश्क है, तेरी कुर्बतों का सवाल है. मैं हूँ इश्क से नाआशना, मेरे दोस्तों का ख्याल है. मेरा कलम है गवाह इस पर, मेरी शायरी भी दलील है. मेरी सांस है जो चल रही, तेरी चाहतों का कमाल है. And most of the time, when we are talking about psychiatric diagnosis, we have to entertain the depth